Let's take you here now. A family of a Bloemfontein man who died outside the Batho Clinic is angry. Jeremiah Moeca is alleged to have died of an asthma attack on a Sunday morning after he went to the clinic for help. Boitumelo Segoe says her fiance left home at 3 a.m. to get help but was denied entry to the clinic by security guards. Now let's discuss this further. We're now joined via Zoom by Mondli Mvambi, Free State Department of Health's spokesperson. Thank you so much for your time this afternoon. Now, according to your preliminary investigations, what can you tell us? What really happened here?
Well, what is known is that the patient who is a known patient of that clinic went to the clinic at around 3 a.m. in the morning, and they were not feeling well. And upon not feeling well, he tried to get help from the clinic, and the security guard at that clinic, which was closed, informed the person that the clinic is closed, and they tried getting help for the patient through calling the EMS services. But unfortunately, the EMS services could not arrive on time, and the person was found having already demised, and the EMS then had to take the person away from the scene. So that's what we know so far. As to why the EMS did not respond on time, we are busy with that investigation to see what could have really happened, so that there's accountability for it.
I'm just worried about the timelines here. Firstly, Mlondi, please, if I didn't hear you correctly, clarify that for me. Why was the clinic closed? And secondly, it's been a week since this incident happened. The family is looking for answers. What is the EMS telling you?
Yes, the EMS will finalize their report, because their reports have to be sent through all the quality check processes in the department. Eventually, that must land with the authorities, finally with the MEC. The reason as to why the clinic is closed. This clinic has been closed for not operating 24 hours. It's operating 7 to 7 in the morning up until 7 in the evening. Due to mainly shortage of staff, there's been a shortage of staff for quite some time in that facility, which does not enable us then to go through the initially commissioned 24 hours that the clinic was due to operate from 2017, when it was renovated and opened for purposes of 24-hour service provision in that area. But what we know is that there's a lot of people that use that clinic. Our nurses don't usually knock off at 7, which is intended, because they have to serve the people that are there up until around 8, 9 o'clock, 10 o'clock in the evening sometimes. So there's clearly a demand for services there. But when we are not able to provide those services, we unfortunately have to close, and we have engaged with the community for quite some time. The chairperson of the clinic committee in that area is also a ward councillor in that very same area. We've done extensive engagement with the community to show them the challenges that we are faced with. But the management of the clinic has not just been sitting idle. They've been making deputations to make sure that the department finds money. And when all those processes, administrative processes, are completed, financial allocations are made, then the authorities will decide on what should happen in terms of whether we go back to 24 hours or an alternative arrangement is made with respect to how the operations of the clinic are.
It would seem that, your efforts obviously did not reach all community members, hence the death of this man who died at the doorstep of your clinic. Talk to us about what assistance, if any, you are giving the family at the moment.
Well, there's consultation. Obviously, there's internal consultation that we are doing with ourselves, focused on the matter at hand. There are many people that die in health facilities. We don't necessarily visit them. We send a message of condolences, and we've done so in this particular instance. There's a debriefing that is offered by the department at any given point in time. If there's any need to do so, there will be meeting with the family to debrief them on what has happened. If they have anything to place on the table of the department, they will place it. Discussions will ensue, and the department will see what is it that is permissible that can be done. But so far, the family has not made any specific demands or any specific request in the part of the department. But I mean, we are available as a department to speak to the family and engage in terms of their needs, in terms of what we can do to assist them during their period of grief. That's what we're currently doing as a department.
One of the things that the MEC of Health, when she took a position last month, but she indicated, of course, with the shortcomings within the Free State in terms of health services, she did indicate that she was going to, be in correspondence with various stakeholders who manage the health sector, of course, also admitting to a number of shortfalls like resourcing, as you've also mentioned. What has she done in the month that she's been on duty?
Well, there's a lot of things. She's looking into the functionality of the EMS, because there's been an outcry about the response times of ambulances in the province. She's looking in terms of the backlogs and the reasons why there's been such an outcry, from the operations of the call centers to possibilities of having ambulances in each and every ward. To expedite the response times of our ambulances, but also mechanisms that can be put in place to make sure that there's efficiency with respect to our call centers, including use of technologies that can be able to make sure that citizens, for instance, when they call, they are able to know from time to time how far is the response with respect to the ambulance that may be allocated to them. So we're looking at those mechanisms. We're talking to the government garage to make sure that we know the number of ambulances that can be made available, that can be rostered, capacity with respect to skill of those that are in the EMS facilities or EMS employed or commissioned to be paramedics that may be responding to any kind of calls. So basically, she's looking at the efficiencies of the EMS service. She has been conducting a number of unannounced visits to health facilities to make sure that there's corresponding effects between EMS response service and the ability of our hospital to provide emergency care to people, but also general care to everybody. She's been conducting, taking healthcare services to the people to make sure that people understand the package of care, the package of services that the Department of Health provides and how they can access those with respect to referral services, with respect to which hospital must I go to or where must I go when I'm not feeling well. I must say that as much as this is one incident, one too many of a death of a patient, the clinic that we are talking about is a clinic that is located within a community that has about 44,000 citizens registered. You know that they are backyard dwellers, which may not yet been accounted for, but this clinic sees more than 5,000 people per month. When we were looking at the records of who comes to the clinic, we have seen people from Lesotho coming to receive services in this clinic, people from surrounding towns around the Free State. So it is a clinic that is actually in in demand, and it provides services efficiently on a regular basis.
Thank you so much. Unfortunately, that was not the case for this particular family, but thank you so much for your time this afternoon. Mondli Mvambi, Free State Department of Health's spokesperson there.